Welcome to a Leader's Journey podcast. I'm your host, Joel Gunn. Today, I have with me a friend of almost 8 years, Dr. John Raimondo. John, welcome to the show.
Hey, thank you for having me. How are you doing today?
Good. Awesome. We've been trying to get together for a few weeks now, so you're in your scrub, so obviously I caught you in the middle of a very busy day.
Yes, I was actually working.
So we got proof.
There's proof.
Now, when people say, does John actually work, they can watch this podcast, and there's some evidence.
At least I'm dressed for it.
Correct. There's some evidence.
I'm dressed for success.
All right. So obviously, there's a lot you and I can talk about. We enjoy hanging out. But one of the things I thought would be cool for the listening audience is you came from kind of some very traditional medicine circles, but the last couple 3-4 years ago, a doctor friend of yours was telling you about this newer, I guess, so to speak, newer technology. You were skeptical at first, but you've seen some crazy results over the last few years from what you've been sharing with me. I know my wife and I have, my wife was really one of the first people to use some of this new technology and saw some amazing results with it. And then, the stories have just multiplied since. So tell us what it is, where it's come from, where you think it's going, why is it not accepted, all those neat kind of things.
Wow. That's a lot. That's like a loaded potato.
Like the setup, right?
Yeah, that's a good setup, man. You got more than 45 minutes? No, I'm just kidding. So it's called Bio Modulation Therapy. We do things in medicine really big names, so it sounds really important.
So you can charge more.
Yeah, pretty much, because they charge us more for the machines. So, some of these machines go for $150,000.
Mm-hmm.
And if you were to make it for like the general public, 15,000 maybe, I don't know. It's crazy the costs that you get incurred on the medical side, for a piece of furniture that goes into a procedure room would cost a traditional business X. And when you put it in a medical scenario, it's like 10X. So then that gets translated on to the consumer, right? All costs, if we don't know this, all costs get translated to all consumers, right? So we pay more for everything. So anyway, but this very big word it's really breaks down into something called light therapy. And it's very powerful. It's been around for a long time. So the sun's been producing it for a long time. God designed it for us. But there's certain frequencies within the bands of light that do things to our cells. And this is not John's opinion. This is physics. This is biochemistry. This is cellular metabolism. All this stuff has been proven. And so a doctor, and it was actually almost 6 years ago, a pain management doctor, wouldn't even tell me about it. He just said, John, come over to the clinic. I want to treat you with something, because he knew I was having some problems with my left hip at the time. He treats me, calls me the next morning at 7 o'clock in the morning and says, hey, how do you feel? And I was like, same. Like nothing changed, right? I was still in pain. I still had a bunch of spasms in my leg, and I've been doing physical medicine at this time for, physical therapy and all this stuff for 18 years probably at the time. So we use ultrasound and all these other therapy modalities. So we never get really quick results typically. And so he goes, come over to the clinic. I'm going to treat you again. So this was a Friday. He treats me. And the reason I remember it's a Friday because he calls me at like 6 o'clock in the morning on Saturday. So I'm like, I answer my phone, which I probably shouldn't have, right? I'm not supposed to have my phone. Anyway, that's another story we can talk about as well. And he says, John, how do you feeling? And I was like, no way. And I start feeling my leg, and all the spasms that I had probably for the past 9 months, everything was pretty much gone.
2 treatments.
2 40-minute treatments. And I knew it was light therapy. He didn't have to tell me what it was because I saw the light, right? Mm-hmm. But I didn't know exactly what it was. So I can hear him on the other line going, I knew this was working. I just couldn't believe it. And there were some other things he said because he was using it on his patient population and he was getting really good results, but he didn't have anybody clinically that could speak his language. Patients don't understand exactly what's going on. So when I kind of... It was definitely a pivot moment for him, and it was for me because I'd been doing this for many years and using traditional physical therapy modalities and stuff and gotten results, but nothing like this. And so that got me on the journey of what this is and what it does to the cells and things like that. And I can go a little deep into this type of stuff, but it really gets into your cells of your body, and stimulates them to produce energy for that cell.
Hmm.
So there's an organelle in the cell called a mitochondria. It's probably the only thing that most people remember from biology, 7th grade, is that word mitochondria. And that thing is called the powerhouse of the cell. Well, when we get really sick or injured, the mitochondria get damaged and they don't produce as much energy for that cell. And part of this process is it stimulates the mitochondria. And then for the next 48 hours, the mitochondria are producing something called ATP, which feeds the cell. God already puts the cells there, not the doctors.
Mm-hmm.
So there's already an inflammatory process. There's a recovery process. It's autonomic, meaning it happens automatically. And we can get hung up in stages of healing because of the amount of inflammation we have. And so this technology reduces inflammation like no other. It's really no other non-invasive treatment. I've taken swollen ankles where the toes look like little sausages. There's no arch in the bottom of the foot. That's how much swelling there is in the foot. And by 3 o'clock, that's 7 o'clock in the morning. And by 3 o'clock, like at least 90% of the swelling's gone.
Wow.
So there's just things like that. And I've shared with you anecdotally the clinical things that I've seen, but I've seen it in all tissue. And that's just what throws us doctors off. It doesn't matter if you're chiropractor, physical doctor, physical therapy, medical doctor, osteopath. When we hear something that works on one thing that works on a bunch of different tissues or systems, we kind of go,
yeah, right.
Snake oil.
Uh-huh.
Right? I mean, I picture the guy on the back of the thing, like selling some castor oil, whatever it was they sold back then, for your ailment, right?
Mm-hmm.
And, but this actually does work because it's working at a cellular level and every cell in your body. It doesn't matter if it's a liver cell, kidney cell, bone cell, pancreatic cell, skin cell, all cells. There's not one that's alive that doesn't have a mitochondria. Again, not John's opinion. This is based on science. And so when we stimulate the mitochondria of that particular cell system, you're going to get more of it. So that's kind of where I'm at. So I've used it in sports medicine, fractures, heal. I don't have a study, but from what it looks like, I'm healing weeks in advance. Mm-hmm. So someone like, for instance, I treated a clavicle fracture that happened April 6th. At the 1 month mark, the individual was doing push-ups, corn-cob push-ups. I had a fracture that was completely bridged with callus bone formation, new callus formation on X-ray, and that's not normal. We normally it's 6-8 weeks, and then we start light rehab. This person's already started back into their sports again. So that kind of stuff. So it speeds up the healing process.
Yeah, and again, I know this isn't necessarily something you can hang your hat on, but in my wife's case, she had a really bad case of pancreatitis, ended up in the hospital emergency room, and was there for 5 or 6 days. When she came home, they had her on such powerful pain meds that she was going through crazy withdrawal symptoms. And over a couple of days, and in the process, you and I were talking, and you said, "Hey, I got this new thing. I'm not sure. I've used it a couple of times. It seems to be working on me. I don't know that you'd really used it on anybody else at that point, but just for the listening audience here, what happened was you let us borrow it and actually take it home because she was having a hard time getting out of bed. Took it home, and you walked me through over the phone, how to apply it and what frequencies to set it at and all that stuff. And I think we treated her twice that day, maybe twice the next day. I think that was it. And then something had come up, some sort of emergency or something, and you needed it back. I don't remember the details, but anyway, so we got it back to you. But so she got treated roughly 4 times in 24, 48 hours. A day or two later, she goes for her 1 week follow-up with the surgeon. Mm-hmm. And so he's sitting there looking at, he had done 3 incisions, and he's checking her out and the inflammation and all that kind of stuff. And he's kind of like, "When was your surgery?" She goes, "Oh, it was a week ago." He goes, "No, that can't be right." He's checking her out a little more. He goes, you said your surgery was a week ago. She goes, yeah, doc, it was you. You just did this a week ago. I think I remember, and I was in a lot of pain. So anyway, he goes, let me find her paperwork. And he looks at her paperwork. He's like, do you normally heal this fast? Like, do you normally heal extra fast? Or she's like, no, normally scars seem to take a little longer on me. Why? And he goes, I've never seen anything like this. He goes, it's like surgery was 3 weeks ago.
Yeah.
And she never told him. He still doesn't know today.
Yeah.
He may eventually see this podcast and go, oh, that's what happened, but
Right.
he had no clue. She didn't say anything.
Right. I've got there's a small group of doctors I share a lot of stuff with, just because I want to make sure my expectations are not interfering with this, or I'm seeing something more into something that there is, right? Because it's not
Not
doing
you're
this,
imagining something. Yeah.
well, or just getting the result that I want to get.
Right. Sure.
Right. And every time I have to pinch myself because it's always like that. I was working with frontline COVID doctors. We treated hundreds of COVID patients and had incredible results, published in a peer-reviewed journal. I think I was the first doc to do it. And then there was a doctor in Canada who used a laser technology, a little different. I used LED technology. There's different ways to apply these frequencies. And then there was somebody in Europe. But I was able to get the first round because I started in March of 2020 treating COVID patients. And so I was working with frontline COVID doctors. They would order it. I would send somebody into the home. We would treat them because a lot of people that maybe a few months into this just didn't want to go to the hospital, and were willing to stay at home and do more things, taking medications and oxygen therapy and things like that. So it wasn't just light by itself; it was a combination, but it definitely improved the patients, especially pulmonary condition, because a lot of patients were having a lot of inflammation in their lungs. And when we used that and we reduced the inflammation, lo and behold, the patient's breathing would improve faster. So, yeah.
A little bit of pulmonary type stuff.
A little bit, yeah.
Since you own a company by that name.
Yeah, pulmonary. Yes. Can we plug pulmonary?
You can plug pulmonary if you'd
Awesome.
like. What are your... How's the general medical community receive stuff like this? I mean, my perception is they're not usually open to anything new or out of the box. What have you seen in the last couple of years as you're talking to us around?
I would say there is. I think COVID really opened the can. To be honest with you, we saw things that were done well, and we saw things that we probably wish we had done differently. I don't like to criticize because you have to think at that time what was going on. We had people wanted answers, right? But the system wasn't able to respond as quickly as we wanted it to. None of the systems were. It wasn't just medicine. We were shutting down. We were shutting down restaurants. We were shutting down our local governments, right? But they could only react to They had to react to social pressure. They had to react to what is everybody else doing. There was just a lot of that going on.
That's a lot of fear.
That bleeds into medicine as well. And it's not always just pride or greed. There is fear.
Sure.
Fear of making a mistake, fear of doing the wrong thing. In my world, I'm able to adapt and move quicker than a system, right? At the clinic levels, we can do things a lot quicker. At a hospital level, they've got a bunch of attorneys. They've got
teams of lawyers,
teams of doctors, and then they've got all these levels, and they've become little bureaucracies, and so they're not going to be able. They can't respond quickly, and so there was a dissension between all doctors in the hospital and doctors outside of the hospital during that thing, because there was doctors outside the hospital that wanted to do things when their loved ones got into the hospital that they wouldn't allow to happen, and it opened their eyes as well. So there was a lot of eye-opening scenarios that occurred, and I'm not being critical of the doctors in the hospitals because they had to do something. I mean, there was people dying.
Yeah.
And
Yeah.
we weren't sure why, and we were getting information out of Europe, and it just moved really quickly. And now I think we've slowed our roll. We're more, we've got more data. And so what's transpired is there's a group of doctors out there that are more open to alternate sources of care. It's nothing's wrong with eating bark or yogurt or whatever, but it's not just something that people are just doing to do. There's science behind other things.
Mm-hmm.
But doctors are trained in doing procedures and using pharmacologicals,
Mm-hmm.
and that's what they know. And so I don't know of a medical school program that's prerequisite is you have to take a nutrition course.
Mm-hmm.
So why do we ask for nutritional advice? It'd be like going to your air conditioning guy and asking for transmission advice.
Right.
I mean, there's a transmission in a car and an air conditioner in a car, but it doesn't make those two systems equal, right? And so I think we have to ask the right people the right questions.
Right? Yeah, I thought it was interesting. You and I were just in a session earlier today where a doctor was speaking, and he shared a piece of data I hadn't heard before. Typical specialist goes to school 13 years, and he's on average with you for 7 minutes diagnosing your problem.
Yeah.
You spend more time getting your hair cut than you do getting professional medical advice. And that was kind of a piece of data that really shook me a little bit, because if you think about it, literally, he's in 7 minutes, you're trying to communicate everything going wrong. And I'm not knocking the doctor. I mean, he's trying to keep up with the patient load, especially think about during COVID.
Right.
There's all this fear, there's all this panic, there's all this unknown, uncertainty,
Right.
There's all the social pressure, there's all the governmental pressures that have never, to my knowledge, governments have never come in and said, doctor, you have to make this claim on your death certificate, otherwise we're not going to process your funds. So certainly I'm not faulting like you. We're not trying to fault the doctors themselves, but we've built such a and I say we because society's allowed it to happen.
Mm-hmm.
We've built a system where it's okay to spend 30 minutes with getting your hair done and 7 minutes with a doctor to talk about this major issue going on in your life. And he's trying to diagnose. You don't know the language to use to help him diagnose it. I know more about telling my stylist how I want my hair cut than I do most doctors how to explain what's going on.
Of course.
I've got I know nothing about cars, but I could probably explain to a mechanic more about what's going on with my car than I can a doctor what's going on in my body in language that he, in his technical language.
Right. I think we're seeing a shift though, and we're going to see there's a positive shift happening out there. There's concierge doctors like the doctor we were listening to that have done a great job in a system, but they feel called to move out of the system. And people that, ideally when you are not in a system, then you don't have to follow the rules of a system, right? So if a doctor he doesn't have to wait if they're a specialist, they don't have to wait for a prescription. There's no rule that says you can't go to a neurologist if you have, seizures.
Right.
The rules set up by the system, whether it's Medicare or Blue Cross Blue Shield or whatever, they're trying to control overspending. So they want to funnel it through a gatekeeper, which makes sense. If you had all the money and you're trying to parse the money out, you want to make sure that patients typically can't self-diagnose. So how do they know they had an epileptic seizure or whatever?
Right.
They don't know.
Mm-hmm.
And so you want to go to a gatekeeper, and then what if the gatekeeper, it takes 2 months to get in to see the gatekeeper or a month? You know what I'm saying? So it's just a byproduct of that. And so what he was saying is hey, I've been doing this for many, many years, and my wife's been doing this for many, many years. Well, there's many other doctors that are they're feeling the same thing, and they're stepping out, and they can give you healthcare access. Because our big problem right now is access to healthcare. Because if you can get to healthcare access quickly, then you're probably going to have a better prognosis. But if you wait and wait and wait, then you're going to succumb to the consequences of that disease process.
Yeah.
It's not always death. It just could be disability or more irritation and more pain and suffering and stuff like that. So if it takes 3 months to see a specialist or 6 months, starting to sound like socialized medicine, even though we don't claim to have it, right? So, I think concierge doctors moving into that world, is a good thing because there'll be a definite change.
Create some competition.
Well, it increases competition, but then the patients that are going to that are going to want more of that, right?
And their friends and family are going to want more, and so on and so forth. Yeah, I was actually at a launch probably about 6-8 weeks ago of a new healthcare app that's trying to do some of the things that the doctor earlier today was talking about. That's going to these concierge doctors and saying, if my app provided the scheduling, how to look into your calendar, we agreed on fixed pricing and all this other stuff. Well, now the average Joe Blow downloads the app and goes, oh, I need, and I'm making this up, I need a dentist to remove a tooth. Go to the app. This dentist has an opening tomorrow at 10 because it's the app's looking at all the calendars of all the dentists that are in the program. This dentist just had a cancellation tomorrow at 10 and it's $150. So what do? I'm on the app. I book it. Right. And I go there, and I probably may or may not be able to run that through my insurance. I don't know, but $150, that's you can hardly get your teeth cleaned for that anymore, unless it's some special that's trying to get you through the door. So
I think that's what we saw with COVID is it opened our eyes to access of care, really. And then you can talk about the things that people do, right? And that's one of the things I was doing was using the light therapy, right? And some doctors were doing other innovative things. But that's where innovation comes anyway. It doesn't come from the good times. It comes from the difficult times.
So I started watching Star Trek reruns when I was like 10 years old. So a bit of a Trekkie and a Star Wars guy. And do you imagine, in the year 2400, the doctors are going to look back? I remember the one Star Trek scene, and for those of you viewers that aren't Trekkies, I apologize, but there's this one scene in the movie that they go back in time, and they're back in the 80s, the original Star Trek crew. They're back in the 80s, and Dr. McCoy they're all trying to gather things that they need to solve.
He's in the hospital, right?
And he's in the hospital.
I remember that.
And they're doing something. He's like, barbarians!
Good God. Yeah.
Good God.
No, but we do it already. When we look back to before the germ theory, nobody washed their hands between things, between procedures. I mean, that's not that long ago. Okay. So we're going to be like, you changed out joints in people's bodies. You took antibiotics. It's going to be archaic. We're doing now.
Yeah. If you think about
definitely.
What was it Star Trek used? It used light and frequency pretty much in all their medical tools. Right. You lay in sick bay and it's scanning you with light out of the visible spectrum most of the time, or they're running the tricorders, across. So I just have to wonder.
There's a lot of foreshadowing in movies. Buck Rogers, space travel, right? There really is. And so I'm trying to say who said this. I got all these quotes in my head right now, but there's one I think Simon Sinek said where success shows up when when reality catches up to your imagination, right, or to your vision, right? And there's a lot of visionaries out there that are working right now on a thing that they're going to be like a Thomas Edison, right? And they're going to stay in that room, closet, garage until it happens, right? And there's still Thomas Edisons out there to.
Do you think society's more ready today than we were 5 or 10 years ago to receive these new ideas, these new technologies, or do you think we're going to be skeptical?
No, I the more people I talk to, it's really patient driven, not doctor driven. If it's up to the doctors, we're not going to change anything. We're Klingons. If you want to stay with Star Trek, we cling on to the information we learned in school. I mean, everybody's so busy. There are a percentage of docs that are reading the new literature that comes out and they're doing things. They're trying to, but that's what pharmaceutical reps are for. They come by, they and they drop some stuff and they tell you what's going on. And then, okay, I got to get back to my patient. You know what I mean? And so it's hard to keep up, especially as the pace of science now is moving faster than it ever has, right? With these AI things. And I mean, we're on the cusp of another movement in science and just technology and medicine and all that, just that whole realm. And so there's going to be great strides. And so whether people believe it or not, I don't care. I mean, gravity, right?
Mm-hmm.
I'm sure at some point someone didn't believe in gravity, just like people used to think the world was flat. The greatest minds, right? I always worry when I hear what the greatest minds are thinking. And I go, uh-oh, we're in
You
trouble.
don't have a good track record here.
Yeah, we don't have very good track records with the greatest. I mean, Salem witch hunt. I mean, let's just keep going back, right? There's other great atrocities, right? When the greatest minds and scientists wanted to do certain things, right? And so I like to be at the ground level. I like to hear what's going on. But what's happening is when I'm talking to more people, people are educating themselves more, and so they're learning about red light. It's really the red, but the group I'm working with out of California, and I'm not going to plug them just because this is a show, is they're working on near infrared, infrared, and red, and then they're working on different colors of light as well, because you can do certain things with different cells in the different spectrums. But they don't work with gamma rays or ultraviolet A or B. They're not working with things that damage cells. These are frequencies that go straight through you. They're not altering the cells. We don't want to do that either. And so I think that industry is going to move pretty quickly because of the results that we get. It's how do we get the energy to the cells, right? The power source and the wavelengths. That's where the physicists and the engineers come in. It's outside my pay grade, but I do know enough to know that there's a lot of stuff out there that may or may not work the same. So you have to be careful in this industry, kind of like you have to be careful with supplements. Not all supplements are made the same way either, right?
Yeah.
And so you have to, what are you trying to accomplish? If you're trying to accomplish clinical things, then you probably need to buy a device that's developed for that, and not something off of Amazon for
eBay,
$800 or something. You know what I mean? I'm not saying you have to spend a lot, but you just can't go out and use any red light or any infrared light and expect to get the same results, because then you need to know about the frequencies and the wavelength, how much energy. Yeah, it's really the energy. So it's like a wave in the ocean, a 3-foot wave in the ocean. Let's say we have a frequency of 3 waves per 10 seconds, and they're 3 feet high. And we're standing on the shore, and that wave hits us. Now, let's say there's frequency of 3 waves, but they're 20 feet high. The wavelengths got more energy, right? So that's what I'm talking about. So if you want to penetrate deep into the cells that are deep in the body, then you've got to have bigger wavelengths, so you have energy to get through and deep into the tissue. And that is where people can get confused, because they're thinking, oh, these are frequencies, right? But if they're small frequencies, right, and not large frequencies, they may not get to what they're trying to treat.
Yeah, good point.
So
so it's several settings or several parameters that matter, and it depends on the depth of the pain or the inflammation.
Where's it coming? The pancreas is not at the skin level.
No.
It's down there somewhere,
kind of
right?
In the middle.
Yeah, it's
from
deep.
front to back.
Right.
Yeah.
And then are you going from front to back, or are you trying to get it from posterior,
Side,
right?
Sure.
So when I treat lung stuff, when patients have lung problems, we lay them down and we treat them posteriorly, because the majority of your lung surface is posterior. It's on the back, right? We typically think when the doctor's auscultating, we're doing it up here, and we do a little bit back here, but you don't realize where the anatomy is. And so, all that stuff plays into it. So standing next to a red light that's 5 feet away, according to the physicists I've spoken to, they're just like, yeah, it might do something for your skin, and it might get in. But with my technology that I use, I know 90% of the energy reflects off the skin if I'm a millimeter away from the skin. That's all light. It will reflect off, whether it's coming in form of a laser or in the form of LED lights. It doesn't matter. And that's just the physics of it. So we've got to have the light source really close to try to get into this. Now, if you're trying to do skin, then maybe a few millimeters or whatever in, then these other sources will work pretty well.
So I've got a random question for you. You mentioned skin and light. What about this whole thing with skin cancer and exposure to the sun, and that's what causes the skin cancer? And then can this light actually heal skin cancer? Can it,
Yeah, that's, I don't touch cancer. with the light right now.
Okay.
I've talked to some of the scientists, and they say you can, but that's for me a taboo.
Don't go there yet.
Yeah, it's there's just I don't think I could live with continue to do medicine if I caused harm, right?
Mm-hmm.
Even if it's an accident.
Mm-hmm.
So for me, I don't touch it. Now the light frequencies that damage skin, damage cells are the ones we got to worry about. When we put suntan lotion, we're not putting it on for red light, near infrared or infrared.
Right.
We're putting it on for UV type stuff. So when you get the sun, it's coming in like a radio frequency. The whole band is coming in at you.
Mm-hmm.
And so we're not administering that. So whatever we administer is not damaging the cells.
Right.
Now it works. I haven't treated burn patients, but from my understanding, it works really well with burn patients. Right. So that's interesting, right? That
because it does heat up some.
right. There'll be some.
Yeah.
Right. There'll be a little bit of heat that gets translated through, but
Just feels like a heating pad
Right.
for those that have not experienced it. It's not like it hurts. It's just
Right.
if you've ever had a heating pad on your arm or your knee or your back or whatever.
and that's not the
It's about
therapy
that.
of it, but
Yeah.
it's because there's resistance as the energy crosses the
Trying to
skin.
push through the skin.
As it goes through the skin, it creates heat.
Mm-hmm.
Right? So there's a byproduct of heat.
And there's some reflecting probably,
Mhm.
even close up.
Oh yeah. There's right. So that's why your wavelength needs to be large, right? So you can really get the penetration into the skin. So yeah, I'm hopeful that they'll be able to do something in petri dishes first, right, on tissue or in pigs or in rats or whatever, wherever we can cultivate the cancer and then treat it. But the problem is I'm not dealing with pharmaceutical companies that have pretty well. The pharmaceutical company, you got to understand, if I'm a pharmaceutical company and I'm trying to do something, I'm willing to risk all this research to get something that I can patent for a period of time so I can earn back my losses of doing the research. That's what it boils down to. As soon as we don't protect patents and do things like that, pharmaceuticals will stop. And we don't want that. We want innovation to keep coming out in the pharmaceutical world. And light is not patentable. God made it, right? It's natural. So where's the money going to come? It's got to come from NIH, our government, that kind of stuff, because they do fund certain things. And so since I was with a group of doctors, I was the author, not the writer. The scientist that wrote the article that went through a peer-reviewed journal just got recognized. And I didn't know this was a thing, but it had 1,000 uploads online, which apparently that's a lot. I was like, just 1,000? Like,
You're
was
used to TikTok typo numbers.
I was like, I don't do TikTok.
No, but
if
I'm
I
just
did,
saying.
I'd be the best at it. No, I'm just kidding. Just kidding. I'd be a talker. No, but I thought 1,000 uploads. But for a peer-reviewed science journal, apparently that was a lot for 2020.
Wow.
And so the group they're gathering more data. We're getting ready to publish on long haul COVID. So because I got very similar results with patients post-COVID when they were suffering from inflammation, because it's an inflammatory process, and the damage to whatever tissues that they were experiencing, whether it was the brain fog or difficulty like a heaviness in breathing, and the brain fog typically leads to a concentration.
Have you run into anybody that's had trouble with sense of smell, loss of smell?
Yes, there was, certain patients through like at the beginning were really experiencing that, and then the patients I saw kind of went away. And then the patients I was seeing out of the hospital either were on high flow oxygen or on ventilators and things like that. So there were, deconditioning type stuff, because if you're on a ventilator for 6 weeks, you're in bed, you're not moving around. They couldn't keep up with the rehab they needed to do in the hospital. There weren't enough physical therapists. I mean, you had to do your own PT kind of in the hospital. There was that. I mean, they were just trying to feed everybody. I mean, they were maxed out in beds, and and think about resources, and then people working, and then there are people getting COVID. I mean, what the hospitals did was pretty amazing. I mean, to manage that type of sickness.
That influx.
Oh yeah. I
It
mean,
was a tsunami hit as far as demand.
yeah, it was huge.
And then there was
At all levels, not
yeah.
just the emergency room. I mean, you just laid it off, and it went all the way through the hospitals.
And there was definitely a fear factor. I know one of my wife's friends, she reached out to, just encourage them. They worked in the hospital, and they were saying, yeah, there's people here literally afraid to walk in to the hospital rooms to do their job because media, society, the fear was on such a high level that nurses were paralyzed. Like, I'm not sure I want to walk in there.
Yeah.
Yeah. Cause I don't know what this is going to mean. And,
Oh, yeah, it was definitely.
you mentioned, light therapy being around for a long time, the sun. And I remember as COVID was hitting and I was doing a little bit of research myself, the Spanish flu in the early 1900s, they figured out they needed to take the patients outside and expose them to sunlight for minutes or hours a day. And those patients would improve rapidly compared to people that were kept indoors.
Our government actually has something on that. It's at the NIH website, nih.gov, I think it is. They have studies. And so they did a retrospective review of light on the Hong Kong in the 50s and the early Spanish flu of the 1900s. Prognosis of light intervention. And so, yeah, these frequencies I use are in the sun. And so some of the patients that couldn't get to me initially, I would say, look, get in your bathing suit, get outside and get an hour or two of sunlight, and then you get to me tomorrow or the next day. Even if you have some symptoms, you can go outside in your backyard. You're still quarantined in your backyard.
Well, in Texas.
Yeah, in Texas.
California, there was some rules around whether you could garden or not.
You couldn't go in your backyard.
Yeah.
Well, that's California. Well, that's another show. That's another few episodes. Yeah.
So the title of the podcast is A Leader's Journey. Where have you been? Where are you going?
Where have I been? I've been all over the place. A friend of mine told me about 4 months ago that my superpower is my ADHD. So I'm just going with it. No, I enjoy what I do. I love what I do. And so where am I headed? I am getting involved more with some nonprofits that have now doing some really big things in adoption, foster care, changing how foster care is done in an incredibly positive way. And the CEO of that company. And then I'm headed to New York, I think in the next week, to treat my first right frontal lobe dementia patient. So there's atrophy. The patient has atrophy in the brain. Why? I don't know yet. So I'm waiting to get some medical records back on that. And so I'm really branching out with this program, and I'm working with and through other doctors who are, neurologists and specialists in their areas. And I'm being blessed because they're opening up their patients to say, hey, we've tried these things. Let's try this.
We've tried the traditional paths. Let's try something alternative.
Well, let's add this. And while we're doing it, because it's not going to hurt. They've already read about it and they're like, it can't hurt. We know.
Basically focused sunlight or selected sunlight.
Correct. So some of the doctors are open, especially if it's their family members. They are more open. It's really hard to go, I know you don't know me. I'm just your doctor. We want to try something new that I haven't done before. I mean, that's kind of a weird conversation, right? So I don't blame them. It's like, but what happens is when family members are getting sick, then they're more likely to refer their family members because they trust me and know me, right? And so forth. And I'd feel the same way. If I'd called an orthopedic buddy and he's like, yeah, I learned this new procedure. Can we try it on one of your referrals? I'd be like, probably not, right? I mean, so
use your own referral.
Right? Exactly. So you can, you know what I mean? So doctors are caregivers, but they're also responsible for the outcomes. You got to remember that. And so it's not as easy to just say, hey, go do this. And so typically it's on themselves, their spouses, their family members that I treat first for things. And then they're like, wow. And then they start sending me different patient populations, right? So that's moving forward, right? And pulmonary is expanding. I worked with, Dr. Bird's company, the inventor of the ventilator, for a number of years. And then we parted ways with the new management last year, the new owners last year. Good. It was a good parting, as good as it can be. And so since that time, apparently I was coveting it too much, and God said, here, we're going to take this away from you. And when I got up off the proverbial canvas, I wiped my tears off and my feelings were hurt, whatever. All these opportunities are opening up. So relationships are opening up. So lots of really cool things. There's inventors that I'm always around that are innovating things. And so I'm getting to sit next to them and see what they're doing, and just getting to watch from afar. So there's some really cool things that are going to be coming out.
So you're more excited about where medicine's headed now than when you started, or about the same?
100%. 100%.
Yeah.
It's very hopeful. A lot of doctors have opened up their eyes and they're looking at new things, but really the patients are asking for it, right? They're more educated.
Yeah, my daughter says, Dad, I got a PhD in Google.
There you go. Yeah, there's a lot of knowledge. I don't know about wisdom, right? I mean, we're in the age of knowledge right now.
Right.
But look, knowledge with some action
creates some questions.
Right, leads to some wisdom, right? If you start with no knowledge and you got a lot of action, I don't think that really leads to much wisdom. So I think we're heading in the right direction, and it's exciting times, and I love sports medicine, so that's the direction. It's another direction I'm being pulled into, and yeah. So
speaking of sports, your boys. Are in their teens now, or getting close to, for your youngest. What have you learned so far in your journey that you hope they'll learn sooner, or hope they'll avoid? Or
that's a good one. Well, I keep saying the saying to them: early to bed, early to rise makes a man healthy, wealthy, and wise. And the world for them does what? Stay up late, get on video games, and do these distracting things. And so I'm really with them saying, look, the world's going to say something. And if you don't have a truth to stand on, right, your own truth, right, then you're going to pretty much fall for the next thing, right? And so I'm really trying to work with them, through sports, because I believe sports does a lot. It makes them coachable. They have to learn. They have to listen to other people, right? Crazy idea. They have to show up. They have responsibility. They have other people that they have to be there for, even if they don't feel like being there. They've made a commitment. They got to stay to it, right? Just those principles. And then they learn discipline, because they got to go. If they're going to become good at something, they got to go and repeat it. So the other thing I teach them is confusion. Then I learned this from my gross anatomy professor. In German, she would say, confusion is the beginning of learning. Repetition is the mother of learning. So embrace your confusion with repetition. Instead of saying, oh, I don't like that, or I'm not a math person, or I don't understand English lit, or, you know what I mean? If you don't understand it, you're confused because you haven't done it enough. That's it. It's just new. So I'm really trying to teach them, because those are pitfalls I would fall into, right? And when I was younger, and it sets you back, right, when you do what the world's doing. And so we can be of the world, right? But we're living in the world, but not be of it, if that makes sense. And I know that's kind of a Christian thing, but it's a life thing, because if I'm hanging out with single guys, then I'm going to be doing single things, right? And if I'm hanging out with successful people in their world, and whether it's manufacturing, whatever they're doing, or sports, then I'm more likely to pick up success principles right, from them, and activities and stuff. So
do you think it matters? There's the old saying, we are who we hang around, what we watch, what we listen to, what we read.
Yeah.
You think there's truth in that?
I think we're seeing it right now. So we're seeing kids with more depression than ever. Suicide is through the roof. Loneliness. We're seeing changes in identities that we've never seen before. But we're also seeing a connectivity to people like we've never seen before. So the influence is coming out in our society. Whether you agree with it or not, that's a different topic. But I've never seen people wanting to meow and bark and use litter boxes. I mean, we did some crazy stuff growing up, but I think there's an influence, that there's something influencing our society, and we're allowing that to happen, and there's consequences to that, right? There's going to be good things that come out of social media, and there's going to be things we're probably going to look back and go, those were like parachute pants, right? In the 80s. I don't know if you remember those, but there's some things that happened in the 80s that we were like, wow, we're like, wow, probably shouldn't have had that long mullet in the back. And I mean, I know that came back, but I'm just saying, there's like things you look back and go, the shirts without sleeves or whatever it was, right? That we can go back and laugh about. Well, we're going to laugh about some of this stuff, right? Because kids are going to grow out of it and in it and so forth. So it's not the end of the world for me. It's just, it's changing. And so do my boys want to be a part of that social experiment, or do we want to stay true to something? The Word of God? Do we stay aligned? I talked to them about alignment, just like tilt your head to God and say thank you, right? And I mean, I'm not asking you to be a monk. I'm not asking you to flog yourself like that, but be thankful for, we have some incredible stuff. Just living in the United States, we have running water, we have toilets, we have toilet paper. I mean, we have lights, we have air conditioning, heating, roof over our head, cars, access to gasoline, access to food, access to access.
Yeah. I know every time I go out to a less fortunate part of the world, I come back going, I've got too many clothes. My closet's too big. My bed's too big. My house is too big. My car's too big. It's just like we have an overabundance compared to
of access,
the rest of the world.
Like nobody's. And then when you have it too good, we start to complain, and that's kind of human nature, right? So instead of being entitled to these things, if you go back and thank somebody for them and be appreciative of them, you'll be less likely to think that you're entitled to them, right?
That's good. Attitude of gratitude.
Attitude of gratitude. And it can start with the big things and go all the way down to the little things. Yeah. It doesn't matter. Even the worst of us have it great here.
Yeah, true. Yeah. Well, brother, it's been a pleasure hanging out with you for a little bit.
Well, thank you for bringing me in to wing it.
Yeah, hopefully you'll come back soon.
I will.
I'm sure we got a few other topics.
If you get more than like 5 people to watch this, I'll be back.
Okay. We'll go pay some people to watch it.
There you go.
Get you back.
There you go.
All right. Thanks, brother.
Thank you, man.
Chat soon.
Appreciate you.